lead, Cambridge North Dumfries, Ontario Health Team. We also welcome Sandy Stevens, our Director of Health and Protection Investigations, should there be any follow-up questions on this week's enforcement activities. I'd like to start by boldly saying, I'd like us all to start seeing this pandemic as more than just numbers. I know it's easy to focus on the daily numbers, a rise in cases today, a drop in cases tomorrow. It makes for easy conversation and makes for easy headlines. But the reality is the true story of this pandemic is not told through the numbers alone. I'm confident that history will show the story of this pandemic in our community and how it responded. Our community was impacted, and most importantly, how we worked together to move through these difficult times. At the Region of Waterloo, we're committed to looking beyond the numbers. We're committed to addressing the full story, addressing the full impacts of the mental health struggles, the small businesses who need our support, levels of governments who are working together to find solutions like never before, and the inequities. In many ways, COVID-19 has made us sit up and take notice. And that's why we're working on a plan for beyond COVID-19. That's why more than ever, the Region of Waterloo, we're committed to building a community that is stronger, healthier, and more inclusive. This week, through our budget process, the Region of Waterloo launched an exciting and ambitious plan for beyond COVID-19. We know that more than 600,000 people from across our community have been impacted by COVID-19. Through intentional planning, we're trying to address this. Each and every one of our 600,000 community members will tell a different story about how COVID-19 has impacted them, their families, their livelihoods. Whether or not you're captured by COVID-19 numbers, think about how you've been impacted by COVID-19. Maybe you're a single mother who's struggling to find childcare. Maybe you're a restaurant employee whose work hours have been cut back. A frontline healthcare worker providing care and wearing PPE all day long. Or maybe you're in isolation because a loved one has come in contact with a COVID-19 case. Either way, your story, your reality won't be contained in today's numbers. Another reality of this pandemic is some have been impacted more than others. It's been difficult, unpredictable year, but not everything has changed. We're still a caring region. We're still a community that takes pride in making plans for the future, ensuring we're prepared for whatever lies ahead. In addition to providing critical services like clean water, transit, and public health, in the proposed 2021 budget, we're focusing further on supporting our most vulnerable, addressing inequities in our community, and the ongoing management of the COVID-19 pandemic. Council has directed staff to aim for a zero tax increase because we know this will have the most impact on families and businesses, but also to look beyond service improvements, not only for savings, but being able to provide opportunity for reinvestment and additional services. We look forward to hearing back from you on our plan. Our plan can be found and opinions can be shared through a survey on our online engagement site, and it's engagewr.ca. There will also be public meetings on December the 16th where we look forward to hearing from the community. There is a potential for an anti-lockdown, anti-mask, or freedom rallies happening this weekend in our region and across the GTA. I'd like to provide some important information about these events and any further rallies of this kind. First, we understand people who attend these events are often from outside the region, who have gone from city to city not wearing a mask, and one would assume that there would be a risk of additional COVID-19 spread within the crowd. This has an impact on our province's hospital system, our ICU spaces, and our testing centers and our labs. The province has asked residents in regions that have been put into one level of the framework not to travel to regions in a lower one. Second of all, our businesses are trying to stay open. Local establishments have shared serious concerns and are planning to temporarily close to avoid harassment. It's unfair to put their businesses at jeopardy right before Christmas and at a time when they are already struggling. The majority of local residents have adhered to public health guidelines and provincial restrictions, in the name of the greater good. These events can diminish some of those efforts, not to mention the ongoing hard work of our frontline healthcare and public health workers who have to work even more when cases and outbreaks increase. This is not who we are as a community. This week's been a busy week for enforcement teams across the region. There are 4 enforcement actions that were taken this week, including a ticket issued by the City of Kitchener bylaw on November 20th at Vita Lounge in Kitchener for failing to obey the continued order under the Reopening Ontario Act for not complying with the volume and distancing requirements. The ticket was a total payable amount of $880. The first 2 charges issued by regional bylaw under the Regional Face Covering Bylaw Act were issued to 2 individuals in the lobby of an apartment building, and those tickets were $200 per ticket. A ticket was also issued by the City of Waterloo bylaw to an occupant of a private residence on November 24th for failing to obey the continued order under the Reopening Ontario Act for exceeding gathering limits. The total ticket payable was in the amount of $880. Last week, the provincial multi-ministry team of almost 30 provincial offences officers were dispatched across our region to carry out a focus on education and enforcement of high-risk businesses where we're seeing spread and where people are letting their guards down. As of yesterday, the team completed 346 inspections and found 73% overall level of compliance with the Reopening of Ontario Act. The most common contraventions observed were related to the zone change requirements when our region jumped from yellow to red in 2 weeks. They issued 4 tickets, 1 to a sport and recreational business, and 3 COVID-related orders to comply issued by the Ministry of Labour inspectors under the Occupational Health and Safety Act to employers for observations in employee areas. Week 2 of the campaign is scheduled to go forward this weekend. This week, Regional Council unanimously passed a motion to establish an interim safe voluntary isolation center effective November the 30th. Today, we submit our application to the federal government for funding under the Safe Voluntary Isolation Center program, and we anticipate hearing back in the next few weeks. When presenting with symptoms, self-isolation is one of the most effective ways to help stop the spread of COVID-19. However, for some in our community, crowded housing conditions and restrictive costs can make it unsafe or impossible to self-isolate, increasing the risk of community transmission. Recent data from the Region of Waterloo Public Health has revealed that lower income neighborhoods, those identifying as visible minorities, and those with larger household size have disproportionately been affected by COVID-19. Individuals from these neighborhoods may have more difficulty properly isolating themselves. This initiative is in line with other measures the Region of Waterloo has taken to address inequities of COVID-19 pandemic. One of our strategic imperatives is that we are a healthy, safe, and inclusive community. This is one way that we can enhance the equity to positively impact the community well-being through our pandemic. I'll now turn the floor over to Dr. Wang.
Thank you, Chair Redman. So thank you everyone for the opportunity to provide an update. So in terms of our overall trends, the spread of COVID-19 in our community continues to increase. Residents should consider that COVID-19 is broadly spreading in our community right now. Our indicators continue to place us within the red control level of Ontario's framework. Our current weekly incidence rate is 70 cases per 100,000. Our current percent positivity, taking into account interim data, is 3.3%. Our reproductive rate has fluctuated between 0.9 and 1.2 over the past week. We continue to experience a larger number of outbreaks, often in workplace and business settings, with spread occurring between employees. In regards to hospital and ICU capacity, hospitalizations and ICU admissions continue to increase. This represents a significant risk for hospitals and their ability to keep all procedures going as planned. In regards to case and contact management, similar to other health units in the red and lockdown zones who have experienced surges due to the acceleration of cases, contacts, and growing number and complexity of case and contact and outbreak investigation, we have been challenged to reach positive cases within 24 hours over the past week. The percentage of cases we reach within 24 hours has oscillated and averaged around 50% in the last week. We continue to implement strategies to address the surge, including redeployment of staff and working to bring on automated processes where possible. The additional staff that Chair Redman and Council requested from the province started orientation and training with us yesterday, and we'll be able to reinforce our case and contact management starting next week. Within public health, we have redeployed public health nurses from our call response to improve our capacity to contact cases and identify high-risk contacts. This has impacted our process for public inquiries that require skilled staff. We will continue to follow up with inquiries by email and phone. Residents with general questions or questions of a clinical nature are encouraged to contact their healthcare provider or Telehealth Ontario. Since public health may not be able to reach you within 24 hours, and you may also see your results online before public health receives them, we are also advising all residents, continue to check for your results online. If you are positive, continue self-isolating. If you are living with others, your household members should also immediately self-isolate and seek testing. If in addition to your household members, you have had close contact with others, that is, you've been within 6 feet without masks for 15 minutes or more, if you've been in contact with these other people outside of your household, within 48 hours of you having developed symptoms until the time you started to self-isolate, tell these other close contacts to self-isolate and get tested. Or prepare a list of these contacts for when public health calls. Please take these actions while waiting for a call from public health. And even before you get a test result, please follow the instructions provided to you by the testing center, including instructions to self-isolate if you have symptoms and are waiting for a test result, or you have been told that you are a high-risk contact and need to self-isolate and seek testing. Earlier this week, the province issued advice for celebrating the holidays. Protect yourself and your loved ones this holiday season by celebrating in person with only your immediate household members, or if you live alone, you may join one other household. Do not attend or do not organize large family dinners, big holiday dinners, etc., any social gatherings outside of your immediate household. I understand that this is challenging. Many of us were hoping not to have to spend the holidays this way and are feeling frustrated and tired of having to stay apart from others. But if given the opportunity, COVID-19 will spread like wildfire. And we know that it spreads easily indoors and in close contact interactions. That is what we continue to see with our current cases. Transmission is happening in social environments and workplace and business settings where people are in close contact with others without distancing and masking. While our traditions may look a little different this year, we can still celebrate. By celebrating apart, you can help protect yourself and loved ones. In closing, I appreciate that the new restrictions outlined under the red control zone of the provincial framework are significant for many in our community. I would like to be clear. The situation in Waterloo Region is serious. The level of spread in our community continues to reach new highs. In addition to these restrictions of the red zones, which are necessary, it is also necessary for all of us in Waterloo Region to dramatically reduce our social interactions, our non-essential social interactions, to help bring the spread of COVID-19 under control. If we do nothing, if as a community we do not aggressively reduce our social interactions, we will spiral into a lockdown. Due to the growth in cases that has already occurred, it will get worse before it gets better. That is why it is imperative that we act now. These measures are difficult, but they are absolutely necessary. The longer we wait, the harder it will be, and the longer it will take to wrestle our case numbers down. Your efforts and sacrifices are appreciated. Thank you for doing all that you can to help our community right now. Thank you.
Thank you, Dr. Wang. Dr. Ball.
Thank you. I think emphasizing the messages of Dr. Wang with respect to being in the red zone are quite critical. Our residents in Waterloo Region, our medical staff, our first responders, our essential workers, our mail delivery, our businesses have all made so many sacrifices in the last several months. When I hear Dr. Wang's message, though, I hear hope as well as sacrifice. In many ways, the virus has shown us that it's not a mystical, unknown entity at this point. It's an infection that spread through close contact. So public health, while we await vaccines and medications, public health and Dr. Wang is in so many ways empowering us to take meaningful actions that will make a difference. Actions such as staying within our own household and wearing masks when at work or school or doing essential trips. And by doing this, we can help contain the spread together. Many healthcare workers and first responders will say they're also tired. And while we were very appreciative of the banging of pots and all of the thank yous in the first wave, really the best thing would be to keep us safe and ensure that we have health system capacity at this point. And to do this, we need to stay at home and avoid gatherings. In terms of the health sector, tremendous work across many settings is happening. Mental health concerns are on the rise, with record call volumes to Here 24/7. But Here 24/7 is open, and it's increased its staffing, both virtual and in-person options to support the mental health of our residents. And there are many initiatives to support elderly or others who are feeling isolated and lonely during this time. Our community paramedics have teamed up with hospital and primary care staff and home care staff to do testing in assessment centers and congregate settings. And of course, we cannot forget the amazing frontline staff the cleaners and the administrators who continue to care for our most vulnerable in long-term care homes and retirement homes, inspiring us every day. I want to communicate that primary care is open. We are open and we are safe. I worry about the inverse relationship that we saw in wave 1, carrying on into wave 2. Namely, our emergency doctors tell us that as COVID cases in the community rise, emergency visits fall. And that leads to people presenting when they're sicker and more often needing admission, which leads to other capacity issues on the system. So COVID does not change how you would enter the healthcare system. If you feel sick, please call your primary care practitioner and they will triage you. And if you don't have one, you have the emergency department. When you call primary care, they will tell you, do you need a virtual visit, an in-person appointment? Do you need to go to the assessment center or to the hospital? Provincial data shows that in terms of primary care visits provincially, in September 2020, they were actually the same in number as in September 2019. So again, we want to emphasize, like the hospitals, we are open and we are here for you. It looks different, but we are ready to help. And lastly, I just wanted to end with a comment. I moved to this community 16 years ago, and I moved here because of the grace and the kindness of the residents of Waterloo Region. And I just want us all to remember that we are in this together. We were neighbors before COVID. We will be neighbors after COVID. And so let's be kind to one another during COVID. And that includes our public health nurses and our public health inspectors. Thank you, Chair Redman.
Thank you, Dr. Ball. I'm now going to open it up to the media. Paula, you're first up. Do you have a question?
Yes, I mean, first of all, it's been a little while since I've been on one of these, but can you tell us anything further about the isolation center, where it's going to be, how someone might get access to it, that kind of thing?
So there's a variety of community players. I don't know if Dr. Wang wants to jump in. I'll just say it will be in Kitchener, and we're planning on a capacity for 30 people. And it is an interim site until we get approval from the federal government. And it's going to cost just short of $76,000 to do it. And it will provide in-care visits, support workers, and wraparound services. Dr. Wang, do you want to add to that?
Just wanted to add that, Paula, there was a slide deck presented at Regional Council Wednesday night, and I'm sure we can make that available to you. It has some more details.
Okay, great. And then a question for you, Dr. Wang. I know that Waterloo Region is home to a number of people who come from outside the province. I'm thinking about students and grad students in particular. Is there any safe way at all for people who fit this description to fly home for the holidays, or are you encouraging people, really to plan on staying put over Christmas?
Yeah, that's a good question, Paula. So, everyone will make their individual decision about that. But in general, we want people to really limit the non-essential social interactions that they'll have, and not get together with other people that they don't have to. So some people may have a need. It's not a wish, it's a need to move from an area to another area. For some others, it may be more optional. Really what we're asking is that people that are in higher risk areas not move to, well, I shouldn't say higher risk, it's higher risk, but areas where there's higher restrictions should not travel to areas where there's less restrictions unless it's essential. And in general, would recommend that people not gather with people that are outside of their household, for non-essential purposes.
Okay. Timothy, do you have a question?
I do. Dr. Wang, you mentioned something about automation in your opening remarks. Is that for contract tracing, or what's that for?
Yeah, it's for every element that we can do in a more automated way. So there's aspects of case and contact, follow-up, investigation, risk assessment, recommendations, etc., that cannot be automated because they require professional expertise. But there are other areas that we are very actively exploring right now in terms of how we can automate them so that we can get some of the messaging out to cases and contacts in a timely way and ensure they have those pieces of information while they await for a call from a public health nurse, for example, that's going to follow up with them. So I don't have any more details at this time, but we are actively exploring multiple options to increase our ability to automate notifications to cases and contacts. That's what I can tell you.
Timothy, do you have a supplemental?
No, that's good. Thank you.
Thank you. Nicole, do you have a question?
I do. Good morning or good afternoon, as I should say. Maybe I'm not sure who can address this. It could be either Dr. Wang or Dr. Ball, but we have heard from multiple viewers concerned about mixed messaging. There's the public health guidelines, and then speaking to a public health nurses, concerned parents saying, despite their child being identified as a high-risk contact due to a school case, a public health nurse has called saying their child does not need testing, and now parents are concerned that their child may be asymptomatic. And this morning I spoke with a woman whose live-in boyfriend was contacted and identified as a high risk. He was tested. Telehealth and the booking center told her as well that she should get tested because they live together. But when she showed up, they refused to test her. And furthermore, the nurse at the facility told her that there was no need for her to isolate. She can go out grocery shopping. She should go back to work, even though her partner was still waiting for test results. So that left her really concerned. Can you please address this mixed messaging as we keep on hearing from people who are confused about what is out there versus what they're being told by these frontline workers?
So who wants to, Dr. Wang or Dr. Ball?
I'll try to start. So, it's we welcome the feedback, to know actually what people are reporting. And, I'm not even sure what specific instance this is referring to, but we will go back and look at our processes and review our processes. If you've received a letter from public health, and I think that's what the parents of I know that's what the parents of children and cohorts that have been dismissed have received a letter, and the letter outlines that the child is a high-risk contact because they were in that class, which is generally the case. They need to self-isolate. They need to go get tested. There are times when people are contacts of contacts, and unless their contact of a contact is showing symptoms, they're not recommended to be isolated themselves. So it's not the same situation. So sometimes different situations will lead to different recommendations. But if you see the letter and it says that in the letter, follow the letter. There's also information that the testing centers have about, if you have this and this is what you need to do after your test. And it's clear that, for circumstances where someone has been a high-risk contact or has had symptoms, they are to self-isolate and to seek testing. So I'm not saying that these kinds of things are not happening. These people are feeling that we're receiving mixed messages, and we'll look into that. We'll talk to our testing partners as well. so that they can review their processes as well. We'll continue to try to make improvements where needed to enhance clarity, to make sure the messaging is consistent. But, you know, really, I know there's written information that's provided, you know, to parents of school children, and there's information that the testing centers also provide to people who have been tested, and you know, they clearly outline the requirements. I would just say follow those requirements. If you have symptoms, if you have been identified as someone who's a close contact of someone who's a case, you need to self-isolate and you need to get tested and follow that direction.
Dr. Ball, would you like to comment?
Yeah, I would echo the fact that obviously the process piece and I think incorporating feedback is very important in terms of the specifics. I would say though that just being on the provider side, I guess, I do know that when there are questions about guidance, or certainly ahead of guidance or communications, for example, with schools at the region of Waterloo, Public Health has actually done a great job providing those advisories, really engaging with the assessment center. There's a regional assessment center team that actually has Public Health sitting there to help provide that guidance and that sort of, I would say, consistent application of the guidance. I think the comment about sort of an asymptomatic, like a high risk contact in a class, you know, do their contacts have to self-isolate has come up often, and the answer has been a clear no, at least from the provider sort of understanding that, more of a self-monitoring sort of situation. But I think that it is possible for sure. I think, Nicole, in fairness, that, you know, that possibly could be like once in a while that we're all, there could be potentially a little bit of error or an interpretation where maybe the provider is not clear. But generally speaking on this topic, I think that there is a really good understanding in primary care and at the assessment centers in terms of how the guidance has to be applied and the communication that's going to the schools that's really being parceled out at the assessment centers with the guidance of Public Health. I think some of those processes are really robust, but of course, no one wants to see anxiety. As a mother, I can completely understand that. And so I think, you know, the region of Waterloo Public Health, from my experience, has been really, really good about taking those cases and trying to unpack them.
Nicole, do you have a supplemental?
I do. And, you know, not necessarily about the schools, but if you are in contact with a high-risk contact and you live with that high-risk contact, can you just clarify, you don't need to self-isolate then?
Hsiu-Li?
Yeah, sorry, the provincial guidance is generally, if you are a contact of a contact, the requirement for self-isolation and testing doesn't apply to you, right? But if the person that you're in contact with is a high-risk contact and they're symptomatic, then yeah, then okay, sorry, I will try to sorry, because I'm getting I just want to make sure that I'm clear. We don't generally recommend that contacts of contacts self-isolate or get tested, but people that are contacts or high-risk contacts of a case need to self-isolate and get tested. Yes.
Okay, thank you. Damon, do you have any questions?
Yep. So first question's for Dr. Wang. Just how concerned are you with people kind of openly ignoring public health measures over this holiday season?
Dr. Wang?
I'm very concerned. You know, we've seen this, unfortunately, play out not only in Ontario, but if you look to the Western provinces right now, who are doing better in the first wave than Ontario, they're doing worse than Ontario. And it's driven largely by people no longer complying with public health recommendations. And so, you know, they've also had to bring in more requirements and restrictions. And this is also what is driving our increase here. And I'm very concerned, and I'm just really wanting to try to make people understand, you know, it may not affect you personally very much, especially if you're in a younger age group, and, you know, by and large, they're not as affected as much as those that have underlying conditions or that are older, but it actually affects the entire community and the entire healthcare system and the entire economy and all businesses when COVID-19 is allowed to spread through people being in close contact with others and not putting in place not adhering to the public health guidelines. When that happens, it spreads very, very quickly, and it escalates and it impacts the entire community. And it will have the effects that we're seeing now. And, you know, in terms of not only the hospitalizations in the ICU, which is a lagging indicator and that comes later, but it affects, you know, all the businesses, all the workplaces, all the care homes, all the, you know, all the type of care that can be given, healthcare that can be given in the community. It affects healthcare workers. It affects, like, it just has this whole system effect. And I just want people to understand that, because I'm not sure people take it seriously enough. And unfortunately, you know, we are starting to see those serious impacts. And so what I'm hoping is now people, they see this as serious now and they take action. And if we take action, you know, we can reverse the trends. So it's not too late. Let's take action before things get worse, like in other areas of Ontario or in other areas of Canada. Thanks.
Dr. Ball, do you want to add anything?
No, I mean, I think that I would just echo the fact that I think many of us do feel that there is a sense of fatigue, and so therefore like less adherence. And I mean, we see that places too. Sometimes I know myself as a physician, I've been invited to some already holiday parties, and I sort of, you know, sort of scratch my head a little bit about that. But I also, you know, have the empathy of understanding that this is very hard, the way Dr. Wang has described. My father has a surgery scheduled. He lives in Acton, a Georgetown hospital. Obviously, I can't accompany him, and the hospital's an outbreak, and neither can my mother. And, you know, talking to patients, you know, just I think, again, there's that fatigue and that loneliness. But the best thing that we can do, and the best thing that, you know, I think we're trying to get across, is to communicate how serious this is. That, you know, when you're younger, or when maybe you feel a little bit less, I guess, affected by COVID, it's really, we're kind of getting to that piece where it feels like we're getting to a precipice, because ultimately, even a young people, many of those, that demographic is often in, as Dr. Wang says, in businesses or congregate settings. It just takes a few people getting sick and infecting other people to have actually congregate settings, which could be destabilized. You know, emergency or ICU nurses, for example, getting sick can destabilize the system, and on and on and on. And so I think we just have to be really mindful of the fact that we're seeing those indicators quite clearly at this point that have put us into the red zone. And I mean, the only step up is lockdown, which nobody wants. So I think, you know, it is really important to, again, be clear that we do have some control, that we're not completely helpless. And if we can just kind of communicate that certainly there's a sacrifice there. But we know that this works. And the idea of flattening the curve is just getting it down under health system capacity. And we are really seeing impacts on our system capacity right now.
Thank you. Damon, do you have a supplemental?
Yeah, just a quick one. I was just wondering how many contacts are people averaging once they get tested now?
I don't have that exact number for you. We'll try to get some statistical updates shortly. But I can tell you that it's still a lot of contacts, And sometimes one person leads to several dozen, and sometimes one outbreak leads to several hundred. So it is the number of cases that come up every day is only the tip of the iceberg, because it is associated with many times more contacts and settings that are at risk, which exponentially increases the number of investigations and follow-up that we have to do. So really, it's sort of that's just, that's when people congregate and have a party, and then it spreads among a few people, it means hundreds of contacts and dozens of workplace settings. And so really, it's just people have too many contacts right now with others that are non-essential and that don't include precautions such as having a face covering on and maintaining a distance of at least 6 feet from other people. So that is the issue right now.
Thank you. Joanna, do you have a question?
Yes, I do. Thank you. Dr. Wang, what prompted you to issue the order this week related to shopping malls and stores?
Yeah, so I think we all kind of saw what was happening in some other areas that were going into lockdown, the massive crowds. We also have received increasingly more and more reports of busloads of people planning to, we don't have, evidence, we don't have names, but, busloads of people planning to go from lockdown zones where they can't shop as freely to areas that are not under lockdown. And, we also know that while some, businesses have really taken care to put in place the recommended measures to enable physical distancing and, allow their customers to feel safe in their environments because they're allowed to, they're able to physically distance, there wasn't a level playing field with requiring that of everyone. And so I felt it was an important addition to the provincial framework because right now in red, retail and stores, they're allowed to operate, and their restriction only the restriction they have right now is just related to their food courts not having more than 10 people, which is the same as in a restaurant. But I felt that there was another issue with crowding, and so there was a couple of purposes. I wanted to make sure that this was a requirement that was made for all retail, whether you're small or big, like a big box store, or whether you're a mall, you have the same requirement. It levels the playing field. It hopefully, in my opinion, makes people feel more safe when they do go out and make the errands that they have to make in these environments, because they know there is a requirement for these environments to enable that. A lot of businesses are already doing that. A lot of businesses in general overall, really want to comply and do what it takes. This levels the playing field, so everyone has to do this. And it also sends a message. In Waterloo region, you're not going to be able to shop in some other places where there's these massive crowds, because here, we're going to have a requirement that in these settings, people will be required to physically distance, and businesses will be able to decide based on their size and space, what the actual limit is, but they're going to have as an outcome that physical distancing is enabled and possible for their residents, for their patrons and their staff to feel safe in those environments. So there you go.
Joanna,
Thanks.
do you have a supplemental?
Yes, I do. It's related to the holiday recommendations.
Yes.
You mentioned for people who live alone that they can join another household. what precautions should they take when they go into that household?
Yeah, so that provision was that recommendation and provision was put in place, as a recommendation province-wide, because we recognize that for people that live alone, telling them to only stay within your household is basically isolating them, period. And so, we want to be able to allow these people to be able to spend some time with others, like other households are able to. And so basically what they need to do is treat that household as their household going forward. So it's one household, it's the same household. So once they go in to that household, they're part of that household, and they have to physically distance and wear masks with everyone else and not gather with anyone else outside of that household, but they can form that bubble, so to speak, with that one other household, and then they stick with it. So that would be just once they join that household, the precautions are the same as for any household, which now they're a member of.
Thank you. Irene, do you have a question?
Yes, thank you. In Edinburgh, Scotland, there's a ban on traveling more than 5 miles from your home unless you're going to work. Has a measure like this ever been considered for Ontario? Has anyone talked about that?
Dr. Wang, do you know?
Yeah, well, I think the province is, I know the province is looking at measures that have been put in place in other jurisdictions, including, in the world and in Europe, and they're trying to look at what might work best. I haven't personally heard of well, I know those kinds of measures restricting, further movement or whatever, is part of a range of measures that are being considered. But I think what the province is trying to do is try to remain commensurate with, what restrictions are required now, based on the actual situations that we're dealing with now, and whether or not we still have an opportunity to, not have to impose further restrictions and stabilize cases and get them down. So even though it's not a requirement, it's still a strong recommendation that people limit their social interactions and limit the amount of times that they have to go out into the community, if they can, and stick to their essential errands if they can.
Irene, do you have a supplemental?
No, that's great. Thank you.
Thank you. Does anyone have a burning question? I think everyone's had a chance. Nicole, go ahead.
The province came out with some projections, and one key thing of note was that, it shows that some regions seem to be flattening the curve. Can you paint a picture of how we're faring here in Waterloo region? Are we flattening the curve?
No, we're not faring well. We're increasing. Yeah, we different health units have been in the spotlight at different times due to their surges at different times. So we've seen some other areas surge before us, like Toronto and Peel, and some other areas, example like Halton and Hamilton, that were put in red a week before us. Unfortunately, in Waterloo region, we are surging, and we continue to surge. And our rates are growing, while overall as a province, the rates are starting to stabilize. So this has always happened in the past, where it's varied across health units. When we were low, Peel and Toronto were surging. Halton surged before us, Hamilton surged before us, and now we're surging. So unfortunately, I can't use the provincial projections to create any updated projections for Waterloo region, because the provincial projections are projecting a slowing down overall, which we see now in the starting to see in some of the larger areas. But and I think they said this yesterday, in some medium-sized areas, in particular, and in our area, I would say, there's continual increases. And so we're in a state where we are still at risk for reaching those original projections of 260 cases or more a day if we do not make significant changes. Now, our rates today reflect what's occurred in the 2 weeks before, and our red restrictions have only come in Monday. So we still need to give them a bit of chance to have an impact. But really, the best thing that people can do is to please follow the public health advice about no social gatherings and only going out for essential purposes, because that's going to have a major, major impact on social interactions overall. That added with the restrictions should hopefully, enable us to stabilize our rates and then start turning them around.
Thank you. Any further questions? Anybody else got a burning question? Joanna?
Yeah, just another question for Dr. Wang. How close are we to coming to a lockdown?
It's not entirely clear because there are no quantitative measures for lockdown. It's a qualitative assessment that red measures have not had the impact that the province is hoping for. So that's why Toronto and Peel went into lockdown, because they were under modified stage 2 first, then they went into red, including with additional restrictions that their medical officers put in. And despite that, their growth was not slowing. And so that is the reason that they were put into lockdown. So there's no exact answer at this point, but it really will depend on how we trend in the next couple of weeks, this week, next week, and possibly the week after. Whether or not the measures we've put in can slow our rates, which is why I want our community to help us, because if we reduce social interactions, we can really help ourselves to slow down those rates. And so it will be a decision that the province will look at on a weekly basis. And they do have weekly discussions with medical officers of health. And so it's something we'll have to monitor closely.
Thank you. I see no further questions. Want to thank Dr. Ball for coming and for Sandy Stevens. Sandy, thank you for being here to answer any sort of deep dives and enforcement. I hope everybody stays well, follow the public health guidelines, and we'll see you next week.